Hello, YouTube. This is Jason Carter with Otsuka Pharmaceutical Development and Commercialization. Recently, PsyQ hosted a webinar titled Defining, Clarifying, and Implementing Digital Health Tools. During this discussion, our speakers defined digital health tools, clarified the application of digital tools in mental health treatment, and outlined the implementation of digital tools in clinical practice. This presentation was sponsored by Otsuka Pharmaceutical Development Commercialization, Inc. and Lundbeck, LLC, committed sponsors of the mental health treatment community. Speakers are paid consultants to OPDC, and I am an employee of OPDC. Let's take a look at a few clips from the webinar.
Jumping on here, as you can see in that middle section, you're actually seeing a quote unquote a funnel. I know this is taboo to talk about in this field, but there's such a thing as learned a lot actually from thinking of it as a marketing funnel, whereas we can think is the highest order, most the most costly, the most difficult to put together, but the most intense would be that in-person visit at the bottom. That's ideally, what we can get people to if they need to, but can we have much easier, more accessible things to meet people where they are at the top? Let them, for all we know, we can get people what they need without having to get to that visit. Let people kind of, in a way, self-triage their way down. You hear a lot, we all work in different types of settings. Some people are like, well, this would be terrible for my patient population, or that wouldn't work for me. I think the biggest thing we need to know is this is not a one-size-fits-all for every type of clinician or every type of patient. It's really about the pairing of that. And if we think of this, even if I work with the sickest of the sick, my patients would never be able to use this, so I'm going to write all this off and I'm going to be against it. I think of it as, what can we do to use this to, in a way, kind of like clear the traffic for you? So get people off of the freeways, let people be met in easier, more asynchronous ways. So it frees up more time, more of that in-person visit time for the people that do need that and work that way. So to me, it's not an either or, but it's how do we best pair things, and how do we meet people where they are and then funnel them to that most costly, difficult to schedule in-person visit, which also cannot scale in the same way that other things can. So if we really want to expand care to patients, it's not going to be one size fits all, but what can we do to open up more of those in-person visit slots for the people that really need it?
I think understanding, like, what is their hesitation? Is it that they're worried about, some of the legal implications? Is it that they don't possess the skills, or is it that they don't have the time? And so how do we, use that understanding to, if those are barriers that we can overcome, then let's make it happen. Because I think these are, there are a lot of tools out there that are accessible, that are free, that can certainly bridge this gap for folks that, otherwise maybe struggle being a good historian in between visits. And so if we can promote their ability to give us data that is reflective of what happens over time by using these things, as opposed to they come in, they've had a rough day, it's not capturing like what's happened in the last couple of weeks, it's really just what happened that morning, that can drive and change what we do with that patient, as opposed to if we have this, looking at over the 2 weeks, it looks like, things look pretty good, but today maybe things are a little bit worse. Tell me a little bit about, why that is. And so I see using these tools as an augmentation, just like Jake was saying, it's another tool in our toolbox. If we don't take the time to educate ourselves about, how to make this an informed process, then yeah, it's going to be a challenge and a barrier, but you're also limiting, some of these things. We're going to continue to evolve in the practice of psychiatry. So you have to stay up to date on what's happening. And I would say there is this divide of, providers not assuming that patients want to use these tools. And that's absolutely not the case. There are plenty of patients that want to use these things, but they want to do so in the context of working with their provider or their team. They don't want to do it in a silo, because if they're taking the time to do this and track that information, they want it to be something that they bring back to their provider and say, hey, this is what I captured. What do you think? And so I just don't want that intimidation thing to be the thing that, says that I'm not going to use these tools. And so that's also in part why we have digital navigators to help bridge some of those gaps and, guide the providers and other members, at least on our team, to understand, if those are limitations, that you're intimidated by that, here, maybe, run through a couple of these modules.
Thank you for watching our YouTube teaser. To watch the entire webinar, please click the link in the description below. Be sure to register for upcoming webinars and watch other on-demand webinars while you're there as well. Hope you have a great day.